Iowa Ortho offers state-of-the-art, comprehensive orthopedic care. Now, the physicians, they're board certified and fellowship trained, and there's a whole team of experts to make sure the patients are getting the best service. Dr. Aviles, welcome to the show. Thanks so much for being here.
Thanks for having me.
So tell us a little bit about Iowa Ortho and your responsibilities.
Iowa Ortho is a great place. I've been here for 7 years, and I can honestly say it's the best place I've ever been to in terms of orthopedic care. We've got 17 locations, over 20 orthopedic surgeons. We can go as far as Manning, Iowa, Marshalltown. We have several locations in town in Des Moines, places like Ankeny, West Des Moines, downtown, East Side. So we're all over.
And with these locations now, I've heard of the sports walk-in clinics. Can you tell us a little bit about those too?
Anybody who gets injured, when you get injured, say you're playing football and you have this injury in the sidelines and you're not feeling all that great, do you want to wait a week to come in?
No.
No, of course not. You want to get in right away.
Yes, absolutely.
So you shoot on down. We have a walk-in clinic right there on the spot. You get treated by a physician at that time, an orthopedic surgeon who is waiting there to take care of you.
And so people can come in, any type of athlete?
Anytime during business hours for the most part.
Sounds good. And assessments given then?
Absolutely.
Perfect.
Absolutely.
So what are some of your responsibilities? What types of surgeries do you do?
So I'm a sports medicine surgeon.
Okay.
So I take care of shoulders, elbows, knees, and hips. But one of the unique things that I do in particular, remembering that we all do some kind of super subspecialization, is that I do hip arthroscopy.
Arthroscopy.
Yes.
So when is this surgery recommended or needed, and why would somebody want to do that surgery?
It affects people from all walks of life. The youngest I've taken care of was 13 years old, to the oldest was 73. It's trying to get people before they reach that point of arthritis.
Okay.
And another term for it is hip preservation surgery. Get there before you need the hip replacements.
So what are the benefits? Just it's less invasive?
Well, you're talking about little poke holes as opposed to big incisions. You're not talking about putting big metal replacements in the hip. You're talking about preserving that joint and making it so that you're just like you were prior to surgery.
Let's talk about the procedure itself. So you said little holes?
That's right, little poke holes, and you take a camera about the size of your pen and you poke it into the hip joint area, and you use similar instruments to actually repair soft tissues, shave any bone away that looks like it's abnormally grown, bone spurs, you may have heard that term before, and basically taking that painful hip and bringing you back to the way of life you had before.
So what's the rehabilitation process like?
It's extensive.
Okay.
It does take a bit of time. So we're talking about 3 to 4.5 months to get better. Is it worth it? We're talking about getting you back to your way of life. So I think absolutely, no question.
That's a great option for so many people, I'm sure. So if people want to get a hold of Iowa Ortho, what's the best way to reach you guys?
I think you just give us a call, 515-247-8400. We'll get you in the same day.
Perfect, sounds good. Thanks, Dr. Aviles.
Thanks.